Hey everyone, Dr. Timothy Gallagher here.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about the difference between function and symptoms. Things that Dr. Marciello may pick up on your physical exam, but you may not be complaining about. We're going to talk to you about why that's so important to identify and treat the patient as a whole. It's going to be a lot of great information here, so stay tuned. Okay, Dr. Mike, all of our patients give you such high grades and comment on how thorough you are with your examination. But I thought it would be helpful today to talk to the group about why it's so important to look at the patient as a whole. For example, we may have a patient coming in for lower back pain, but why do you look at their neck, their mid-back, their knees, their hips? And why is that so important?
I think it's relatively a simple answer is that we need to know how the whole body is functioning. Person complains many times of just their individual pain complaints. That's what bothers you, your shoulder today, or maybe you're coming in for your knee. But how that plays out in relation to how they're sitting, how they're interacting with their office, how they're trying to exercise or not, those things play a role in relation to all those mechanics from top to bottom. And that's why we always look at the whole person to make sure they're functioning and adapting to whatever their current pain complaints are.
Right. Case in point, we just had a patient with pretty acute lower back pain, symptoms going down into the leg, and obviously the focus was the lower back. We got an MRI, but we did a little further evaluation. We were a little bit concerned neurologically on a reflex finding. So Molly went ahead and ordered some imaging of the neck. Now the patient didn't have any problems with the neck, but why did Molly go ahead and order x-rays in the neck, and why are we looking at, teasing that out and maybe even considering a cervical MRI when there's no pain associated with the neck?
Well, that comes down to just some good old diagnostic tests in relation to examination. When we know from our spine perspective, neurologically, there is some connection from the neck going down into the lower back, and those neurological findings that we are picking up on exam do kind of tell us maybe there might be something else going on. So we still go back to our basic understanding of how the body works, and from an evaluation or examination, we need to know that. Relative to the neck, that may be affecting the lower back because there's increased muscle tone or muscle spasticity, or again, the nerves that might be aggravated from a pinched nerve of the lower back might be altered in what we see when they're complaining of their neck pain or not complaining of their neck pain. So relatively, we do put those two together, and it works the other way as well. So if a person's complaining of neck pain and not their lower back, they may be sitting funny, they may be kind of doing things that are awkward, that may be throwing off something else. Commonly, we'll see the neck associated with the upper back and shoulders, the lower back commonly associated with a person's hip, or so some people come in complaining of one thing when realities are we've teased out that there's something else. But we want to take that extra big step of saying, well, those elements of function or the lack of function, what the person is unable to do or having difficulty doing, may be connected to their other problems. And so we look at the whole picture every time.
Yeah, I think the messaging is pain is always going to be the last symptom. And just because you don't have pain doesn't mean that everything is normal. Case in point, we had another patient that presented last week, a 25-year-old extremely healthy male who did a lot of weightlifting and physical fitness, was in top shape, had some acute lower back pain, but that settled down. So he was ready to go back to the gym just based on how he felt. But when we reviewed his exam findings with him, he had profound weakness in his left leg. And even though he was feeling well, that neurological deficit led us to go forward and get a lower back MRI on this patient. And he has a pretty decent sized disc herniation. So folks, remember, pain is not always the reason. We need to make sure that we're thorough during your physical exam. And you will be blown away once you come in and see our medical director, Dr. Mike Marciello, and his nurse practitioner, Molly. They do an outstanding job. And once we do get an accurate diagnosis, well, that's where the fun begins, because as an integrated medical clinic, we combine medical care, physical therapy, and chiropractic treatment under one roof, and all of the providers working together when it comes to Dr. Sherman, Dr. Brooks, the other Dr. Gallagher, Dr. Colleen Gallagher, our PA, Alex, we're all going to make sure that we take the best care of you and offer you holistic treatment options that emphasize getting to the root cause of your problem. And best yet, we take most insurances. If you'd like more information about our practice, please look us up on the web at maragalmedical.com, and also consider subscribing to our YouTube page. Our YouTube page continues to grow. We've got a lot of great information out there. Well, that's it for today. Again, I hope you learned something. Have a great day, everyone.
Bye now.